Two of the most important issues in pediatrics today are mental health and health disparities. In this video, we address the intersection of these two issues as they affect Black children and their families. The Roadmap Project is an initiative of the American Board of Pediatrics Foundation that aims to improve the emotional health and resilience of pediatric patients with chronic conditions and their families. This panel session was recorded in April 2021 as part of a Roadmap Project learning session. As context for several references in this recording, this session took place during the closing arguments of the Derek Chauvin trial for the murder of George Floyd. In the next section, we meet the panelists.
My name's Robin Kinnebrew. I'm from Cincinnati, Ohio. I work in human resources, and I have three sons, two of which are twins that have sickle cell disease. They are 23-year-olds now. So we've been involved in the hospital system for a long time. They have since transitioned from children's to adult, and that has been a challenge also. So I serve on the American Board of Pediatrics, their Family Leadership Committee, and also their, not the credentials, but the Conflict of Interest Committee. And I'm happy to be here. Thank you.
Thank you. I just want to say, Robin, Robin's voice is one of the reasons that there is a sickle cell disease network beginning nationally, and it's been terrific to know her and work with her. Next slide, please. Christian, hey, welcome.
Thank you, Carol, for having me on. My name is Christian Lawson, and I'm originally from Atlanta, Georgia. I'm currently a student here at Oakwood University, studying theology and broadcast journalism. I've suffered with IBD since 2008, particularly Crohn's disease, and I've done an extensive amount of work through a health learning network called Improve Care Now, which treats IBD patients. I was the former PAC co-chair for the Patient Advisory Council, and now I am serving as a member of the DEI committee, which is their diversity and inclusion committee. And so I'm happy to be on this panel discussion today.
Hi, everybody. My name is Tawana Nishibayashi. Say that 10 times fast. I am from Chicago, Illinois, and I am a heart mom. So I am the parent of Avery Grace, who was born with a congenital heart defect, hypoplastic left heart syndrome. She had 3 open heart surgeries in her first year of life. The 4th and the 5th which was a heart transplant, that happened before she was 3 years old, and we are now almost 2 years post-transplant. So I have been thrust into the medically fragile parent community and the heart mom community. And outside of that, I am a life coach. I've become an advocate. I'm very active with the Children's Heart Foundation. I head up their diversity, equity, and inclusion committee. And so Christian and I have something in common there. And I'm also a DEI consultant on my own outside of the Children's Heart Foundation. I'm on their medical advisory committee. I am their volunteer director. And all through it all, I've got Miss Avery Grace. So it's very, very nice to be here. Thank you for having me.
I'm Latasha Rouse. I am from North Carolina, here in the Triangle. I am a birth and postpartum doula. I am the mother of a 11-year-old. I have to get the ages right. 11-year-old with autism. And we just had our evaluation yesterday. And my triplets that were born at 26 weeks are 8 years old. So I've been doing this type of work ever since a little bit after the triplets were born. And I am on the membership, a member of the Family Leadership Council for ABP, and a subject matter expert and team member for the several state collaboratives, and then the national PQC, Perinatal Quality Collaborative. So that's a little bit about me.
I know one of the things that we often hear from all parents is when we think about the how are you doing, assume we're not okay because there are other things going on. I know some of you had said if you are going to ask that question, have some things to think about or to offer us.
Having, those resources in the community and having those, opportunities for help that you can't give in that space is important, because otherwise it just feels like a big letdown. It feels like you are asking the question, and now what am I going to do? I just had to think about it again, and I don't have anywhere to go.
I think for me, and my experience has largely been, inpatient and medically complex, and a lot of traumatic circumstances. And my daughter just turned, she's 4, she'll be 5 shortly. And so it's all rather fresh for me. And so for me, I think when someone asked how I was, I didn't really have the wherewithal to say how I was. I didn't have the bandwidth to speak on how I was, let alone come up with, an accurate response. And so your default becomes okay and fine. And for me, that was twofold. One, because I need to be in a safe space in order for me to feel, safe to be vulnerable. And those circumstances where I was asked how I was, it's not that the question may not have been genuine, but I didn't feel like it was a safe space that I could be vulnerable and share my truth if I had the moment to think about it, right? And then second, is even if I had the safe space without really knowing and being able to ascertain in the moment how I am, people ask how people are every day. Hi, how are you? You're in the elevator, you all, hi, how are you? How are you doing today? How do you know how much of that is authentic and how do you know how much of that isn't? And then I'll add a third on there, just what Latasha just mentioned in terms of resources. If I say that I'm not okay, what will you say then? So even if I'm able to dig in and find my truth and I feel like I'm in a safe space, which is all these qualifying factors, I say that I'm not okay. And then you say, oh, I'm sorry to hear that. Or, but do you have a brochure, or do you have a group, or do you have someone I can speak to? Or, what are those next steps? And so I think having those foundation layers of next steps to kind of qualify that question are great. But I also think that you can't just walk in and say, how are you? And expect an authentic answer all the time, especially for people of color. We have to feel safe to be vulnerable. And it's not often that we feel that.
I would agree with Tawana and Latasha. Just building that safe space is important. Going through talking with doctors, I always felt like I had to be strong in the first place. So to be able to let down my guard, that was something that I think was earned, and it was a process. So if they did offer resources, I would feel comfortable enough accepting the help, first of all. And I was just happened to be looking online, and in the Black community, you always hear, there's a saying like Black doesn't crack, and which basically means, we look younger than we actually are. But, I like this quote, and it came from Therapy for Black Girls. And it's not that Black doesn't crack. Yeah, we do look good. But Black cracks from the inside out. So, you may not see what's going on the inside, but there's so much going on the inside. So we may look like we have it all together. We're trying to fit the part, dress the part, speak the part. But inside there's so much going on. So if you do have resources, if you do have a community, a peer group, those are all great things that would be, nice to have available.
And I think aside from our trauma we may be experiencing on behalf of being advocates for our children and not being able, to crack externally and holding it all together, et cetera, and trying to overcome those, societal norms that kind of have us having to overcome things, right? The systemic racism that exists. But, Christian in particular, and then for those of us who are mothers of sons, and just being Black in general, this past year and a half, Carol, thank you for alluding to it, we carry around trauma that I don't think people are aware of. It, whenever you see someone that has something in common with you and something, happens to them, right? You feel it in a visceral way. So if you're a mother who's had a miscarriage and you find out someone else has had a miscarriage, your empathy meter, right, is like right there, because I know what it's like to lose a child or to try really hard for a pregnancy and find out it's not viable. That's terrible. We turn on the news and we, turn on the news, or we walk out, into the street, or we show up at a medical appointment for our child, and we're carrying trauma. And sometimes we're treated in ways that exacerbate that trauma. And so the trauma is on so many different levels. It's the trauma of having a medically fragile child. It's the trauma of, just being a Black individual in the world today. It's the trauma of seeing ourselves murdered and our, the murderers go free, and all of these ways that we're ascertained, and we don't know if we're safe. Forget about the safe space. We don't know if our bodies are safe out in the world, because it's been proven that they're not, and that when they're not, nothing really happens. And so we've got all of this swirling inside of us. And so practitioners, can you, as you're seeing your child, come in and tackle all that? No, but that safe space and that how are you, and that empathy, and kind of keeping that top of mind that this person's carrying a lot, and we're all carrying a lot. That's the deal. The older you get, the more things you carry, but we're carrying a lot. And so we're liable, when we do crack, to crack harder and bigger. And if we do that, then we can't care for our child, let alone ourselves. And so I think that's important to kind of keep top of mind. Not only do we have the George Floyd trial going on, but in the midst of that, we have Dante Wright. And in the midst of that, they're going back. A gentleman who was an armed officer fighting for our country, and he got pulled over. And so there's things that are just at the forefront right now, in addition to taking care of children, advocating for ourselves, just trying to be whole. And I think current events play a part, and if practitioners could pay attention to that, that would be helpful for us.
I think for me, the real hard struggle as a patient to be in that condition is to see your mom not be able to do anything for you, and to recognize that you're in a situation where you don't know personally as a patient what's going on with you, what's happening, what's bothering you. And then as a mother, to see her firstborn child out of 2 children having such a chronic condition and a chronic time trying to handle a disease like Crohn's disease, it is really difficult. And the fact that it took us a long time to figure out what was wrong didn't even help the situation at all. When you ask me that question as a patient, how am I doing? I don't know how to feel, because my mom doesn't know how to process this. The rest of my family doesn't know how to process this. My friends don't know how to process this. And even me as a patient, the mental strain that it takes on me to really process this, to really say how I feel, I don't want to genuinely say that, because if I say that, then you look at me as weak. You look at me as somebody who supposed to be the strong back, the strong arm. And in all seriousness, I'm not that person. I'm just like everybody else. I struggle with things. I have mental illness. I have all these different problems. I'm not okay. You're waking me up every day to get laughs. You're doing all these different things to me, and I don't know how to feel. So when you ask me that question about my mom, I have to close myself out to stop talking to her, because I know that in the back of her head, every night she's going to sleep and she's concerned about me. She's concerned about me, and she doesn't know exactly what's going to happen the next day when she wakes up, or what's going to happen the next time she takes me to the hospital, or what's going to happen when I go into the clinic. So that's what I feel like that's what encapsulates a Black mother's mind, is the fact that I don't know what's going on with my child, but at the same time, the people that I'm taking my child to give me comfort, to really figure out what's going on, aren't really providing me with the mental support, the supportive environment that makes me feel like I'm okay to let my hair down. I'm okay to really share how I feel.
And it makes me really think back to why I opened up the way that I did to my pediatrician when she asked me the question. And I did feel safe. I did feel like she stepped out of character for me, because that's not a conversation. She'd never asked me before. And in that moment, I knew she saw me, and it was safe for me to talk to her and to tell her. And I was able to break in that moment. And we were just 2 people communicating. We weren't playing roles. It wasn't mom and doctor. It was 2 people, and she cared about me. And so in that space, I felt like I could talk to her. She did go try to find resources. She worked through, and she called me personally several times as she hit roadblock after roadblock. She wasn't able to get me help, but I knew I could go to her because she tried.
Mhm. Mhm. Yeah.
You know, you're taught early on, you are over time learning that you have to be seen as non-threatening. You have to be seen as well-educated. You have to be seen as strong in order for healthcare professionals to deem you as acceptable. So this is a person I can relate to. This is a person I can talk to about the care details, and they will be able to understand, digest it, and make a decision. So you learn that when you walk into that space, you're on your way to the unit and you're getting it together. You got your clothes on, you got everything together, and you're going in to look okay. Like, I'm watching you to see, do I look okay to you? And if I can get in there and you start to tell me I can pack it all in, I can fall apart at home. But while I'm there, I have to look okay.
Mhm.
There's also that angry Black woman stereotype,
Mhm.
right?
Mhm.
And so if you're strong and if you're assertive and if you use your voice, you can be deemed that angry Black woman immediately. And there's not really coming back from that. And so you have to still be strong and assertive, but in a pleasant way. You know, you have to, you wouldn't be able to tell that I wasn't one of the attendings because I intentionally made sure that, you know, and if there was a new attending every week, I had to prove myself again. I had to use the verbiage. I had to, you know, the medical terminology. I had to prove that I knew my daughter's case. I had to, you know, drop other doctors' names, et cetera. And so it's definitely, and it's not just in a medical setting. I think in the world, it's called code switching, right? It's called playing the game. It's anytime you're not around your own, you know how you're supposed to be. You get pulled over by the police. You know how you're supposed to be. You change the radio station. Don't listen to hip hop. Oh, no, 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 no. You know, you change the radio station. I was Christmas time and I got pulled over for my new thing in a suburban town. And I turned on the Christmas music right away. I've got my daughter's heart stickers on the back of the car and a car seat in the back, but none of that mattered. And all I thought of was Sandra Bland on the traffic stop. And so you translate that into an environment where we're worried about our child's life or we're trying to be taken seriously for their care. And you're going to put your best foot forward because you can't be unstable. You know, you can't look unstable. You can't look overly emotional. You can't be angry. And every day it's proving, for me, at least it was proving that I, you know, was academically strong, that I was smart, that I was, you know, how many times was I told I was articulate, right? As if I was not supposed to have a great vocabulary. It's a surprise. And so these are things that I'm sure all of us, you know, Christian and Robin and Latasha have experienced in the past. But when you're worried about your child's life, you're trying to take care of your child. The last thing that you should have to do is add on layer on top of layer on top of layer of ways to be acceptable. So you fit in this little box so that you can then be a proper advocate for your child. And you see the parents that don't do those things, they're not treated the same and their child doesn't get the same care. And so I would try and bring those parents up, right? Like maybe you shouldn't come to the rounds with your scarf on. Like maybe you should unwrap your hair. Maybe you should, you know, you just have to look. You have to look the part, play the game, and code switch. So those are all terminologies that you guys can take with you. But when as we are, and sometimes, you know, sometimes we wanted to get cute that day, right? And sometimes everything is okay, but sometimes it's not. And I would have loved to been able to wear athleisure wear, right? And put my hair in a messy bun or whatever. But that would immediately take away some of the ground that I gained, you know, with the people around me. And so I could never do that. And we were in the hospital for 4 months this last day. And so that's what I did for 4 months, 7 days a week, Saturdays and Sundays. And that's exhausting. It's exhausting.
I wanted to add, being a sickle cell patient, first of all, we already have a stigma associated with the disease. So we're not even given the benefit of the doubt sometimes walking in the door, no matter who you are. And I want to agree with Tawana and just say how exhausting it is. So I'm bringing my son to the hospital. You know, they might be in pain. They might need oxygen. Who knows? They might need blood. But on top of all of that, you know, I have to make the staff feel comfortable. I have to make them accept, you know, who we are. You know, I'm trying to, like Tawana said, And Latasha said, talk a certain way, dress a certain way, be a certain way, just so that, you find us acceptable and that you feel comfortable coming into the room to talk to us. And it does start over. Every time a new nurse comes in, every time a new doctor comes in, we're trying to build that rapport and let them, know and understand that, we are concerned parents. We do understand what's going on. We do have questions. And to treat us the same as if, we were somebody who were non-white, who might be standing there, in sweats and their hair in a ponytail. And, we're standing there dressed up, or, just trying to look presentable so that we will be accepted and still receive the same type of care. So I just think it's exhausting, trying to deal with that on top of everything else that, that goes on. So.
Thank you, Robin. That was really hard to hear and important for us to hear. So thank you. Christian, did you want to add anything in there?
Yeah, so for me as a patient, I remember recounting times where we had the room all decorated. We had pictures, we had different things on the wall because my family, we have a great sense of our beliefs. And so I remember a lot of times people would come in and they would look around the room and they'd be like, what's going on? Like, why is there all this stuff around the room? But it had to, for me, it had to become my home. And for a long time of being in there and really just experiencing the health crisis that I dealt with, it was hard for me to really be okay. It was hard for me to really put on this face of I'm all right, At the time, I remember I had a haircut that I needed to get done, so my barber came in, and so all those different changes are things that we as minorities have to deal with. Like, there's no barbershop at a hospital. So the fact that my barber came in and actually cut my hair was just something that was very significant to me. I remember my mom, she had to go through the same thing where she always had to dress up or look nice, look very presentable, like she wore dresses. She didn't come in wearing like pants and a casual shirt or anything. But for me, as a patient, I was able to do that. I was able to come in with a shirt or with the pants or change my outfits according to whatever functions I needed to do while I was in the hospital. But one of those things really just, it just disturbed me because most of the patients down the hall didn't have to do that. They didn't have to worry about that. But we as a minority family had to do that. We had to be concerned about it. And so that's where my experience comes from, is the fact that seeing my mom had to wake up every day to do that just really shifted my mind when it comes to the inequalities in healthcare.
Latasha, you worked for a while as I think, family advisor in a community hospital neonatology ICU, and based on having had the triplets there for a long time. You shared a story of how you coached other families.
So I had to make sure, starting with the dads, a lot of times, especially with Black men, talk with your hands. Well, I had to explain to them that it is seen as a threat. So when you have this little doctor coming in and she's 5 foot tall and she's a little white lady and she's coming in to talk to you and you're upset, I want you to sit down and say it. You can still have your response and say it clearly, but if you stand up over her, that feels very different to her. No, we know you're not going to do anything. We know that you're not going to harm anyone, but she does not know that. And I want you to be able to come see your kid. You don't want them to say, you can't come back up here. Your baby needs you. So when she comes in the next time, you can say everything you need to say, but I need you to sit down while you do it. And with moms, I had to sometimes I'd spend an hour in advance talking to them so they could get some of the emotion out of it, so that by the time they hit the room to talk to the doctors, they were able to get it in a short span of time, get it clear, and make sure that when they're saying it, they're getting a response that is not seen as emotional and angry. So to take some of that bite out, I would take the bite and I say, okay, now I heard all that. Let's get it down to something that we can do something about, and that you won't be seen as angry, even though you are. I need you to save that for that one good time when they need to hear all of that, because it might get worse before it gets better. So hold on to it this time. And the next time, they might need to see some of this, but don't do it now.
I think everything's documented, everything is documented in ways that we don't always see or have control over. And you don't know what that narrative is going to be in a patient's chart, and you don't know what the word of mouth is going to be within a hospital system or, within a provider's office about what kind of patient or family you are. And so for me, maybe I'm arrogant, I never thought that it was time to take my child away from me. Like, no, I personally did not think that, but I could see how they would. I was more, concerned for me about being labeled, as like difficult and my her care not being taken seriously. But there have been times where they're kept, patients in a hospital longer because they doubted the care, the family, that they didn't think that the family members could take care of them. There are times when CPS has gotten involved, and I've seen it happen around me. And so for some, it's a very real fear, especially if, I think who you have on the panel today, by the grace of God or whatever our innate skills are, we all have the capability to grab the medical, we know the medical terminology. We know what's wrong with our children. We learned about it. I know all about the heart. I know all about, how different medications coincide. I know myself, we can speak to our children's issues, but not everybody can. And so, not being able to do that, that makes you frustrated, that makes you scared, that might make you act out. And there are all these circumstances that kind of get thrown into this pot that can boil and blow over. And then, because maybe they don't think you were the most involved, maybe you didn't know you had to be, maybe you didn't know how fragile your child's life really was, what the circumstance was, but people will get that preconceived notion and then they start to call people in. And, there are a lot of times, there's a lot of people that you encounter in a hospital system that a certain narrative can become the overarching one, but it's not necessarily the real one or the true one. It just gets started and then it gets added on, and got this preconceived notion and misperception about what a situation is. And it all starts with just like one or two things, right? And then they'll say, oh, well, in the chart, this happened, or they'll talk to a nurse that day. Nurses are great at the gossiping portion, and so you get all together, and nurses are fantastic too, but, that together. And yes, it's a very real fear about the safety of your relation with your child and whether someone could take them away, for sure.
I remember having that feeling several times because I had 3 little people, and they were, my son was, when he was discharged from the NICU, he had 7 medications, G-tube, oxygen, heart monitor, pulse ox, the whole thing. But they were talking about traching him, and they called me in to talk about it. And in that moment, I thought, you better look really okay with a trach. You better look like I'm gonna figure this out. I'm gonna be able to do this with these other kids, or they might not send this kid home. And then I remember also having the thought again, just in general, making sure that I'm presenting, I have this. It was always in the back of my mind, but I had it again. We went to an appointment to meet with everybody, and my husband in that moment, I don't know why, he had a real moment, and he said, is this really necessary? Like, the steps we're taking and what you're talking about, is this really necessary? Do we have to do this? And I looked at him like, but of course we do. We'll figure it out, because dude, you can't say that to these people. You say it. Yes. And so he's, went on and back in his world. And I'm like, what just happened?
Sometimes it's not necessary though, but you can't tell them right there. Sometimes
you gotta work
necessary, but you gotta work through it.
So I guess the thing that as clinicians, one thing that I would recommend is just really thinking about the patient as a whole. Yes, we are minorities, but at the same time, we have feelings, like I mentioned earlier. And a lot of times those feelings have to be bundled or compressed because we don't know exactly how you're going to respond. And it brings us to a point where, like, I still have problems. I still have difficulties with exposing how I feel and sharing how I feel. When somebody asks me if I'm okay, I've been through so many traumatic experiences as a kid that I don't know how to respond. And my friends have a hard time with getting it out of me. My family has a hard time with getting it out of me because I don't really know how to tell people or equate to people exactly how I genuinely feel. And it doesn't make it any better in the health sense that when I walk into an environment where there's not a lot of people that look like me, there's not a lot of people who understand where somebody like me, a patient that's been dealing with this for half of his life, and now walking into this adulthood, not really knowing and seeing all these current events that have happened and seeing the deaths, it scares me, it frightens me. Because that can be me. That can be me. That can be my friends. That can be somebody that I know that's very close to me. And so one of the things that I would recommend is just be authentic. Be authentic and really try to understand a minority's perspective of how mental health plays a role with whatever they're dealing with, whether it be sickle cell, IBD, autism, whatever their underlying conditions are. Remember that there's a mental aspect that also affects that, not only for the patient, but for the parents, the moms, the dads, the brothers, the sisters, all of them that have to be in the room when you're giving a diagnosis or when you're having these critical conversations about the care of that particular patient.
I would add health disparities to that too. Keep in mind, the different outcomes, mortality rates, and the health disparities in regards to the minority patients that you're seeing. Mention them, bring them up early and often to let us know that you're aware. But I would challenge everyone, and I know that this is a very focused effort, right? But I would challenge everyone to go back to the organizations and try and make them more inclusive and work from the inside out, because representation matters. And you know what? We're going to feel more comfortable when we see people that look like us that aren't just on the janitorial staff, when we see nurses and doctors and more respiratory therapists. And, so advocate for that within your organization. Advocate for building new sourcing pipelines and advocate for employee resource groups where you can, have these conversations and advocate, working with your HR, make it look different. And so there are people that are going to not have to try quite as hard as you will to have relations with us and to build a relationship with us, but also so that we see when we walk in that, okay, maybe I can let my hair down a little bit because look, this is the rainbow, like literally everyone is here and everyone's represented here in a clinical perspective and a provider perspective. And so, this is a place that I can let my hair down a little bit. And so do those things and be willing to have these uncomfortable conversations, because it's going to be awkward to begin with, especially if you are a person that is not of color, you're not Black, you're not brown, you're just not of color, and you're coming and you're trying to create this safe space and let us know, that you are authentic and that you are an ally. But it has to start with being willing to have the conversations and being willing to maybe bring up some stuff, that happened outside, not in a political standpoint, but just from a standpoint of, I see you and I see your struggle, or, maybe just quoting different, getting back to those health disparities, or quoting, in Black patients, there's this, or, mental health, how is mental health viewed? Just kind of just bring things up that might be a little bit awkward, but it's through those first stumbling blocks of conversations that you begin to build that relationship. And let us know that you're different, that you're different than what we maybe are stereotyping you to be, or what you've been showing us, to be to us in the past. I think those uncomfortable conversations and doing what you can to change things on an institutional and systemic level are huge and will pay big dividends over time.
So one of the things is that if you're at a clinic where you have other minority fellows or people that you work with, spend some time talking with them and have these critical conversations of how it feels. Because a lot of times I feel like if you're in the same realm with somebody else that might be working in your clinic, then they'll be able to share some things that you might be blind to or you might not really understand or really get. And I think that will help healthcare providers get on the right track towards working with minority patients and their families.
I was just going to share an experience we just had. My son was in the hospital a month or so ago, and the doctor walked in, introduced himself, talked about my son's condition. He asked questions. He listened to our concern, and I did not know him from any other person. But he was open to listening to our concerns, asking our, answering our questions. So I think those are just small things, to help start building a trust. Because he was willing to, I asked him a question about a certain medicine, and he went out of his way to set up a meeting with the this was inpatient on a Saturday, to set up a meeting with the pharmacist so that we could ask the question. So I think sometimes just small things that helps build a rapport with the physician so that you can, grow from there. So, when you're talking about swift wins, he didn't come in and, I've had doctors come in and they talk super fast. So they're trying to, to me, it seems like they're trying to get in and out. They don't want to answer any questions. So all of that plays a part in just developing a quick win, no matter what's going on. So
we are weary. We absolutely are. We are weary. We are fatigued. Our souls are weary. But for everyone else, this is a heightened thing of the past year and a half. This is our this has not started happening. This is just the forefront because it happened. We had to keep things happen during a pandemic where everybody's eyes were there. And so they had less distraction, right? But so we've always been carrying this. So it's not so new that this is our burden. I think, yes, it becomes weary when, especially if you're working for an organization and because you're the de facto person of color, you are now this DEI for me. Start this program, be the spokesperson for everyone in your race on top of everything else. But I think what you're speaking about from, a clinician patient perspective and a clinician, patient family perspective is really just the acknowledgement. I think the acknowledgement is missing. The acknowledgement is not happening. It's not that we are expected to come and, teach you about racial justice and social justice issues. I don't think that that's, but it's acknowledging that we are dealing with these racial, justice and social justice and these inequality and this systemic racism. And so acknowledging it in a way that we know that you see us, we know that you recognize health disparities, we know that you're looking at us as a whole child and a whole family, together, regardless of race. We know, like someone said, color, we know that you are acknowledging that there's differences because of what our experience is, because of our race or our nationality or ethnicity or what have you. And I think, having that, even the pictures, like the marketing that you have around your practice or in the office matters. There's just things that kind of like pinpoint, the dolls, the coloring books, just, everything that you all goes to paint this picture, this layered picture that like, okay, that's one more thing we can check off. That's one more sign that we can breathe a little bit. Coupled with what Robin was saying, just show genuine interest in what we have to say and trying and asking questions. And I think all of those things put together, having resources, then when you do say, how are you? All of that stuff kind of slowly over time starts to play at some of the issues that are happening now and create that safe space you're speaking.
The idea of when you encounter a patient, for me, it was very helpful when I had their undivided attention, when they looked me in the eye and stayed there as if they were checking in with me, asking the question about what's going on, how am I doing, how's everything been going. If something had just happened in the news, like what we've all seen happening, just saying, I know it's a really hard time right now. You don't have to quote stats and acknowledging that it's a really hard time right now. And just leave it there because they know now that you at least know what's going on and that it may have impacted them. And then also I always say, the sitting down at the beginning when they first come in and you're like, you're rushing to get in the room and they help you to calm down for a minute and breathe and be able to actually be present. All of those things show caring, they show warmth, they show that you're wanting to hear what I have to say. and it allows me to open up. And over time, a couple of those visits helps to build in that trust that, oh, they're going to ask me how I'm doing. They're going to want to know what's going on with me. And so it starts to become a rhythm, and it becomes comfortable, and you can start to peel back the layers. I was just going to put in a plug because a lot of people think they know how they would score on an implicit bias test. People think they know. But once you take it, you might be surprised. And I say that because I took it. And the first time I took it was very different than what I score now. So it can change. Whatever your scoring is and whatever your outcome is on that, it can change with work, with being intentional about what you're digesting and who you're around. So that's what I would say.
I think awareness is huge. I think it's not a silver lining or a gift, but I think, it's overdue, but what's happening now is that awareness has been created. There you go. I think awareness and empathy and relationships, I think those are all things that will help. And aside from the race issue, someone put in the chat that a doctor will spend like 13 seconds or something, coming in and speaking. When Christian, I'm sure, knows it being his own personal experience, but then Latasha and Robin and I as parents, know that, gosh, when you're in the hospital or you're dealing with doctors again and again over a long period of time, if you don't have people that you feel like you can relate to or that relate to you, it takes a fatigue on the entire family. And so I think worrying about the relationship, my program that my child is in is amazing, but only in the past couple of years have they gotten into the whole child in a neurodevelopmental clinic and multidisciplinary and really making sure that they're not just trying to save lives, right? But the quality of life. And so I think if you take those things into consideration, the quality of life, not just for the child, but for the family, because it'll pay, that all plays together and into how the child is doing. And then that awareness and having empathy and building relationships as much as you can with the guidelines that you can, it can happen. It can happen and it'll make a difference. It'll make a difference in outcomes. It'll make a difference in patient satisfaction, I'm sure, and clinician satisfaction. And all of you are here because you care. And so because you care, you're willing to do the work. So take that implicit bias test and ask your attending these panels, keep learning on your own. There's books, there's resources. And as long as you do all of those things and you spread that to your colleagues, you won't win all of them, but you'll win some of them. We'll all feel the reverberating effect.
I definitely agree. I appreciate you taking time, first of all, to hear our stories, to hear our concerns. And I feel like the more you know, the more you can share. I think peers are influencers. You can influence other doctors, other practices, just as parents influence, other parents or other patients influence, outcomes. So I just want to, first of all, thank you. And, as you learn, hopefully you can teach things.
One of the things I want to leave you guys with is 2 L's: listen and learn. Listen to what your patients have to say. Listen to what your parents have to say, especially minority parents. And then also take some time to learn. I think a lot of times, especially when it came down to my care, I feel like my doctor didn't really take time to really listen to me. And if he would have taken more time to really listen to me and listen to some of the concerns that we had, I think my outcome as a patient would have been better. But I also think that he never took any time to really learn how it is to be a minority patient, to really learn some of the struggles that minority parents and families face, in order to get a better grasp of how to deal with minority patients. So listen and learn are the 2 things that I would say care providers need to learn.
This has been, let me say, thank you. This has just been really wonderful and very powerful. And I really am grateful to all 4 of you for sharing with us.